Has anyone else noticed how plastic surgery is like everywhere these days? Seriously, it has become the new norm. But let me tell you, plastic surgery mixed with social media insecurities is a total disaster. It is the worst combo ever. The proof is that recently, an Insta-Famous plastic surgeon took a woman's life. And as if that wasn't bad enough, this so-called surgeon endangered and harassed many others before anyone even realized what was going on. What did he do? How did it all go so wrong? And most importantly, was he ever caught? Let's find out. This is the story of Dr. Arian Mowlavi, arguably the worst plastic surgeon you could ever encounter, and I'll show you exactly why. Dr. Arian Mowlavi was born in Orange County. He was an ambitious student who finished at the top of his highly competitive high school class. He even delivered the commencement speech at UC Berkeley, where he graduated Phi Beta Kappa before earning his medical degree from the University of California, San Diego. His career was quite impressive on paper, we agree. At 18, he told an Orange County Register reporter that he had dreamed of being a doctor ever since he saw an ambulance as a child. He said he always wanted to know how they felt, knowing they were about to save someone's life. But today, that same doctor has caused so many women their worst nightmares. As Mowlavi's career progressed, he built quite the personal brand. By the time he opened his plastic surgery practice in Laguna Beach, he had branded himself Dr. Laguna. He liked to call himself a sculptor of the human form and even published a book, High Definition Liposuction. In it, he described himself as one of the top body sculptors around the world. Not just that, he also promised that his results are always beautiful, majestic, and real masterpieces. Then came his foray into social media. Hungry for fame and fortune, he started posting surgery videos online. Here, he would show his work and describe how patients on his operating table wanted more magic or pop. He also mentioned in his videos that his specialties included vaser liposuction and Brazilian butt lifts. He operated on more than 10,000 patients and had hundreds of thousands of followers who wanted to get operated on as well. And now this is where things started to go wrong. The audience noticed that he had developed a personal scale to classify patients' bodies and the results he wanted to achieve. In one video, he commented on a patient's belly button and rated her back as a 3 or 4. How unprofessional and insensitive is that? Despite his crass approach, he gained an audience and plenty of views, all driven by people's insecurities. And among all those vulnerable individuals was one woman who fell victim to his promises. Promises that turned out to be nothing but illusions. In 2018, a woman went to Mowlavi's clinic for a tummy tuck and liposuction. Mowlavi agreed to operate on her and decided to target her abdomen, back, and thighs. This procedure was supposed to be a routine cosmetic enhancement, but then everything went wrong. Instead of performing the entire procedure himself, Dr. Mowlavi allowed 2 unlicensed surgical technicians to handle the removal of fat from the woman's body. This decision was not only unprofessional, but also incredibly dangerous. Hours after the surgery, the woman began experiencing severe shortness of breath. She collapsed and was rushed to the hospital by ambulance at 1 a.m. She arrived unresponsive. Medical staff immediately began working to save her, but her condition was already so bad. Dr. Mowlavi visited the patient at the hospital and told everyone that she was not going to get better anytime soon. In fact, he diagnosed her with an anoxic brain injury, which is a severe condition caused by the lack of oxygen to the brain. This injury indicated that her brain had been without oxygen for a significant period, which led to irreversible damage. Despite the efforts of the medical team, the patient died 3 days later. The cause of death was determined to be hemorrhaging. It was clear that the hemorrhage was caused due to the surgical intervention she had undergone. You would expect that after such a terrible handling of the patient, Mowlavi would have been suspended, arrested, or at least questioned. But no, he walked free and kept giving consultations like everything was normal. The patient's family never gave up. They kept fighting for justice and filed a lawsuit against Dr. Mowlavi. In August 2020, Mowlavi decided to settle the case and paid the family $1 million. But the California Medical Board did not wrap things up until 2 years later. When they finally finished their investigation, they had a lot to say. They accused Mowlavi of gross negligence, dishonesty, corruption, and not reporting the incident on time, and just being downright unprofessional. Their decision was to suspend him for 90 days, give him 10 years of probation, make him take mandatory educational courses, and a practice monitor. He was also banned from supervising other doctors. 2 years is a long time. Just think about how many patients he treated during those years. None of them had a clue that their doctor had killed a woman on his operating table. The investigation took forever, and meanwhile, people were in the dark about his past. They should have at least put a warning on his record so patients knew what they were walking into. Then there was Judy. Judy was a 60-year-old preschool teacher who had followed Dr. Mowlavi on social media for years. In November 2020, she went to him for a small liposuction procedure around her bra line. But Mowlavi had other plans. He convinced her to let him do more. He promised her better results if he could remove some skin too. The surgery happened, and days later, Judy knew something was wrong. A few days after the surgery, she took off the foam dressing and she saw how horrible her wound was. It smelled awful and hurt like crazy. After more than a week of intense pain, she collapsed at home. Her family rushed her to the emergency room. They found out that her organs were failing. Kidneys, liver, lungs, heart, everything was failing. Everyone she knew was called in to say their goodbyes while she lay in a medical coma for over 2 weeks. Even after waking up, she spent 2 months in the hospital as doctors worked to remove dead tissue from her back. And did Mowlavi stop? Nope. He kept on going, hurting more people along the way. It is just plain reckless and heartless. Eventually, more and more patients started sharing their stories and realized they weren't alone in their horrifying experiences. They banded together and filed a lawsuit. The shocking part is that this lawsuit was not just about his medical malpractice. It was about his harassment and unprofessional behavior. In December 2021, this class action lawsuit was filed by over 30 former patients. They claimed that Dr. Mowlavi groped them during exams, made inappropriate comments about their bodies, changed their bodies without consent, and even gave some of them life-threatening infections. And if that wasn't enough, another patient died in 2022. This led to the California State Medical Board suspending Mowlavi's license to practice for 3 months. The problems in his practice were evident right from the exam room. According to the class action suit and the DA's complaint, he allegedly forced patients to strip naked, grabbed their bodies, and made unsolicited comments about their appearances. One particularly disturbing story came from a 16-year-old patient, MP, who said Mowlavi promised to make her look so hot and like a model, and he said it while pinching and shaking parts of her naked body. Another patient claimed that he made a derogatory comment about a previous patient and referred to her as a whale. When JH called him out, he just laughed it off. The women alleged that Mowlavi used these consultations to upsell them on procedures, where he pointed out flaws and pitched quick fixes. His staff would even look up patients' home values on Redfin before appointments to gauge how much they could afford. One woman went to Mowlavi for liposuction on her arms, but was made to stand fully naked in front of a mirror. He grabbed and pulled at her body, telling her that her flanks were the real problem. Another woman, who sought a breast lift and a mini tummy tuck, was asked unsolicited questions about her labia and pressured into additional procedures. Shailene Johnson, who was a former fitness influencer and patient, described how Mowlavi groped her repeatedly during a consultation. She said that Mowlavi grabbed and lifted her breasts and lower stomach to demonstrate the results he promised. He even made her get naked in front of 2 unidentified men. In the operating room, multiple women reported harassment. One nurse recalled him commenting on a patient's large lips under anesthesia, while another witnessed him slap a patient's butt, calling it hot. The harassment does not stop here. During post-surgery visits, Mowlavi would often show patients' naked bodies to potential clients or visitors without consent. A client recounted how the doctor spun her around like a trophy in front of an unknown man during her post-operative massage. Another heart-shattering story was shared by Millie Martini, a 49-year-old hairdresser. She said that he pressured her into a mommy makeover, and then she woke up slumped in a wheelchair only to learn that Mowlavi had not completed her surgery. Her nipples were black and oozing, and she later discovered they were half off. Despite her pain, Mowlavi convinced her to undergo another procedure under the guise of post-op checkup. She woke up bleeding and her nipples were gone. After that, Martini went to hospital and she was diagnosed with acute sepsis, cellulitis, and severe anemia. Doctors told her she would have died if she had waited another 24 hours. She eventually sued Mowlavi for medical battery and emotional distress. Many women in the class action lawsuit had similar stories of botched surgeries and life-threatening complications. Thankfully, the lawsuit filed by the 36 plaintiffs has been won. It resulted in a $6 million settlement. Back in 2022, he tried to file for bankruptcy, but no one was fooled since it was discovered he had transferred all his money to his wife's account a while ago. Now, he is no longer practicing, which is a relief for everyone. This whole situation tells us why it is so important to always do your research before visiting a doctor. You never know what might be going on behind the scenes. Stay informed and protect yourself. See you next time.